Okay. We need it unlocked and pointed down just a little bit.
Unlock and so down is.
Doesn't matter, just there's an inside and an outside knob and you just twist them. That'll work. A little bit more. There we go. Okay.
Cool.
So that's the epiglottis right there. Okay, that thing. Now behind it, you come up, that's the vocal fold. So if we go down in here, we're going to be in his trachea. So, oops, he just swallowed. Okay, you might cough. Okay, let's see if you can lift up. Okay, that's his trachea. They're tracheal rings and he coughs. Come back out.
Like, I'd rather you didn't do that.
Go ahead and water, please, so I can see. Excellent. Perfect. Okay. Now, more towards the top. See the two white lines on either side? The little white.
Oh yeah.
Okay.
Like little
Yes, those are the guttural pouches, so I can slip in there. That's like a eustachian tube, making infections in there. Okay, rock it back, if you would. Just push both of them back, because there's two. There's one on the small knob on the outside. See the F? Oh, it's already on. Okay. So now I'm not even going to look, because I don't want to. We're going to keep his head bent. We're going to see if we can't. You guys can watch the screen, but there may not be much to see. And I'm just feeling the back of his throat, so when he swallows, I'm going to push in. Okay, now you can unlock both.
This one, and the other lock is this one?
Right, yeah, on the outside. See how? No, the other way.
Ah.
Okay. All right, air and just air for a second. Some water. Okay, see how that looked different for a second there? Let's come back. There. See how it's all squishy? Like, I don't know if you could tell, but when we're in the trachea is a really hard, rigid, round tube with rings in it. This is mushy, and this is the esophagus. So all we're going to do now is feed the tubing.
Yeah.
The stomach looks really cool.
That's what you can see inside it.
Yeah.
Pretty sure his stomach won't be as clean as Teddy's.
Yeah, that is true. It's not
Keep the air going
I think
all the
it's
time.
they still need to go down a little bit. You still have to break down some.
Air.
I think that's
just
cool.
air.
I think there's something like that.
It feels like.
What is it? Yeah, it's a bit dirtier.
So it's halfway in the
All you have to do is close the top.
Oh, okay. And press it now.
So the other thing is that the stomach itself is doesn't need to expand unless it's also soft, like the esophagus is soft. So we really can't see very much. What you're actually looking at there is the squamous part of the stomach, which is there's a. So
Kind of.
It's real loud right now.
I do feel like we're one of those deep sea
Yeah, it looks much
adventure
different.
films. You know, it's just.
okay.
You might have to sort of touch it.
So if you follow on that diagram, we're down at we're down at this. We've come down the esophagus. So if everybody can see the screen. So our tube is where my finger is. Okay, and what we're looking at is the squamous part, or the non-glandular part. Here's the glandular part. The part that splits the two is called the marga plicatus. We're going to come in and we're going to look at this area right here, this whole marga plicatus, because that's where the acid splashes up and causes ulcers to form. Then we're going to try to come and loop around and look back at where our tube came in. And then we're going to try to loop around and up over the top and come into this pyloric area, which is the small intestine area.
Sorry.
It's got a belly, I guess.
You can actually see the
Just
tube.
jets, little jets.
Ah. That's better.
And keep the air on. Change positions. You're going to actually push the tube in.
You're welcome.
Okay, let's go stay right where you are. And there is no, this is not a skill set. This is just, you just turn the darn thing and figure out, there we go. Which way do you get the best picture?
That's the white part.
So that's, yeah, so y'all turn around on that computer if it hasn't gone dark again, right? And somebody's tapping, yeah, so it keeps things alive. So, and then as we go down, so when you have a really bad ulcerated stomach, you're gonna see ulcers actually all the way in here. See, that's actually,
So
the
that
black
stuff on there was food, yeah?
is all food, yeah, and you can kind of tell that.
And
because it's really-
watch out.
let's see.
I don't think you see that part.
Are the spray pool guys ready? Watch the
Yeah.
screen.
I don't
They're
think
sweet.
We didn't get to see it. Big
Michael. So that coming out on the screen is what he's pushing in right here. Sweet, right? If you need somebody to do that, we can get him.
Yeah, these are volunteers.
Hey, Will, come on over. Will was here for the last one too, so.
Yeah.
Right, Will, scoot under and watch your head.
So we're gonna come down, ooh, look at that, isn't that fantastic? So,
So then-
so guys, look at the, go back to the computer behind you, right, and tell me where I am.
Along here.
Yeah, so what's the red part?
The glandular mucosa?
Yeah, that's the acid producing cells. Okay, these are in water. Yeah. So if you open this up, there'll be some back caution. So stick that on there. Yep, good. And just push. Just push. Ah, excellent. Great video.
I am good at reading.
See, and that's all you need to do this. Microsurgery. It's a minimally invasive surgeon to be, because it's all video games.
Poor Show's gonna have to pee after all that.
Yeah, so, and that's actually a fairly nice edge. You got let's go. Oh, get down. There you
So the ulcers would show up along that
go.
border.
And you can kind of see there's one little one. I think right. There.
So what do they actually look like? I mean, is it going to look like a cold
I
sore
got-
or?
Yeah.
Just
it'll
a
be,
red
it'll be
spot?
a reddened area
Okay.
in that. And this is again interesting enough. So probably right there.
Yeah.
Actually, be honest, that's going to be food. But we're not looking for. My argument is I'm not looking for one. I'm looking for the whole thing to be reddened and irritated. Okay, why don't we try washing this area off here? Okay, so it's going to be back flush with that.
She's
Yeah.
I'm videoing it.
So I imagine he's pretty acid with having his stomach empty all the time. Your body's appreciating the water.
So horses only produce acid when they need to produce that.
People.
People are, that's right, it's people.
Horses produce it all the time, which is why things like Malox and Malox and antacids and bicarbonate, they only work for the time that the bicarbonate's there. And when it leaves, within like an hour or two, you're back to being an ulcer case.
So it's better to have
It's better to
Food
use the
at all
Pepsid.
times.
Well, that would be the key if you can do food all the time. All right, so let's just play a little bit. We'll come up here. Like I said, this isn't really rocket science. Then we're just going to just feed it in. Just push. No, push. Push. Okay, stop for a second. There we go. Okay.
Oh well, so that's where it's coming.
Can't get the dirt off it.
Oh, that's so wild though.
Bones are very nuts. That's not a bad picture. Okay, so now what have we done? So what are we looking
moved
at?
around.
the
Yeah,
turnaround.
so that thing that says 30 is the scope, right? So we've flipped back 180 degrees on ourselves, and that little tiny opening it's coming through is where the esophagus comes into the stomach, and that's it. So that's what they call the lesser curvature, because it's the first one we saw was what they call the greater curvature, because it's the widest or longest curve.
So are we looking down now? Is that the
No,
bottom?
look-
Back
look it
to-
up.
Go back to your.
I'm just trying
Go
to.
ahead.
So all we've done is come in and looped horizontally.
Looking back, yeah.
We've
So
looped
what's-
horizontally around. That's the bottom of the stomach. That's
That's what I
the
was-
oh yes, that's the entire Margot down there, right? So we're almost at we're sort of at the top, looking.
Down.
We've come in and up and around.
And looking
so now
down.
yeah.
Okay.
And that's a lovely picture of the whole, sort of a global look at the stomach. Now, maybe, and you're far away so you can't tell, but again, we're not looking for single ulcers, so they're right about where that pointer is. Get down
Do
there.
they cluster that?
No, they're generally pretty all over the place.
Does
But
H.
all
pylori
along that,
factor in at
oh,
all?
did you see this, you guys see the spit? If you watch right around the tube, if we stand there long enough, a bunch of saliva will roll down.
Oh, there it is. Is that it coming?
That's like a little shooting star. I have no idea what that is. There's the esophagus contracting. See how it squeezes around?
We'll swallow the guy.
I'm not waiting however again.
So wild.
It'll kind of go from just by the 30 mark to the left of the screen. That's not near as exciting.
Oh, the image on that's not
Actually, if you hit the space bar,
This?
Space bar. right
hang
there.
on a second.
Wait a minute.
Okay,
And
go. Perfect. Every time you hit the space bar,
it,
it takes a picture.
yeah.
So you can-
I used to be in church for that.
Yeah, you did a great job of when
Okay,
Kenny
let's
gets
do the space bar again.
blocked.
You can space bar whenever you feel like it. If you think it's
Oh, watch out, you might have a lot of pictures.
Yeah, this is, okay, so let's go and in further, just all the way.
Shows are just.
If I start getting in your way, let me know.
Give me a show. Yeah, whatever. You want me to?
Worst that can happen, it'll just come out the other end.
They can charge for two things. That would take a lot longer.
I don't think your scope
Okay,
is
so-
long enough
That
to
was
do
much.
that.
I am actually a certified internist, so I'm board certified in internal medicine, so I am an expert. I have no clue where I am. Just so you guys feel okay when you're at the doctor and you're like, what's going on? I don't know. Yeah, and so, but the good thing is we know that there aren't any huge blood vessels down there. And so, I mean, right now we're buried in a bunch of fluid, and I'm just trying to figure out how to get up out of it.
Oh, they're bubbles for a moment.
Bubbles. Bubbles. That's what people call them.
You feel it sliding on my head. Wow.
It's like a shot of this.
It's quite interesting.
Easy, Lucy.
You tie the knot itself.
Honestly, yeah.
We'll get into that.
Well, clearly,
Clearly, let's see.
Up.
ooh, that's a lovely.
Lots of bubbles.
Bubbles.
Cluster of bubbles.
Yeah.
But I'll know if you want to.
Thank you.
I think there's a bubble.
That's the
on
word,
screen,
Lucy. Thank you.
Like around the.
Well, I'm in that fluid pocket. That's the problem. I'm trying to figure out how to come up.
That's lovely.
A lot of bubbles.
There are just
Taylor, Lucy, why don't you move over a little? Let Taylor on there with you. Just move over a little. Taylor, you can kneel on with Lucy.
Oh, thank you. Sorry.
That's me.
It's all right.
You want to sit down?
You're in there doing something.
And see, even holding them off all that time, you still have all that fluid stuff on the bottom. Kind of beautiful look at the last one.
This fluid didn't contribute much.
No, there's not much.
It's pretty big. I mean, what's the space in there? Pretty big.
It's about 9 liters, which is 2 to 3 gallons. Just went by.
Pretty big, Steve.
Oh, there it is. Okay, so that squishy looking thing, that's actually small into the small intestine. So that's the pylorus. See it here?
Bye.
Bye.
Just
What'd you hit?
put the cursor, just tap twice on the, there you go. Okay, so we're actually where we want to be. We're just going to air it a little bit. So this is, if you look on the screen behind you again, this is the pylorus. So we've gone all the way around and we're actually in the beginning part of the small intestine.
It's good you pointed where. It's going to be very educational.
And the incidence of ulcers in this area is, you're just as likely to get them here as you are to get them along the margo plicatus. Now, the thing is that just because you have a really bad margo plicatus doesn't mean you're going to have a bad pyloric area or small intestinal area, and vice versa. You can have a beautiful margo and have ulcers here.
So are there any? I don't see anything that looks like what I imagine an ulcer would look
But
like.
if any kind of gets clear like that, fire off a shot. No, because see how nice and clear and pink that is?
Yes.
There's nothing, and you're really looking for something that's really angry.
Oh, that's a beauty.
And see how it looks distinctly different from the other part of the stomach? There's not that kind of, just come back.
The humans have the problem with the H. pylori causing the
Right.
ulcers. Does it same thing for the animals?
No, these guys don't have, there is Helicobacter in there, but it's not been associated with, and they've looked really hard to try to see if they can fix some of these things with antibiotics, and really don't, so there's not really a reason to throw them on an antibiotic regime. So then, and I'll show you some pictures of one that's got a bad pyloric area. Those take a lot longer to heal. So in the discussions that we have, I've been guilty of this too, of going, well, let's just do a GastroGuard trial. And I will tell you that the vets that go, let's just do a GastroGuard trial, are the vets that don't have a 3-meter scope. Because they have no way to look. And the thing about scoping, when you talk about, I mean, there is no false negative or false positive. If you see the ulcers, they're there. If you see the entire GI tract, which we have today, and there are no ulcers there, then there are no ulcers there. The problem is let's say we go in and we have one that's got a really clean margo, but that pyloric area is really sunburned and angry, and looks like the skin's peeling off it and stuff like that. Well, you stick that horse on GastroGuard for 10 days and it'll kind of get better, but then it'll get immediately worse when you take it back off it, because you're actually looking at 3 to 4 months of treatment. And not just with GastroGuard, but with some sort of anti-acidic, again, the bicarb comes in there, the ranitidine or cimetidine that you hear about that people will take. You've got to really get on them with more different medications. You have to approach it from more than one different area. And the other thing you need to do is treat them for a lot longer period of time. And I've had other horses that like my own, when I had horses, you throw them on GastroGuard and their behavior changed. You put them on GastroGuard for 2 weeks. Well, in 2 weeks something else changed as well, because by the time you run a scope into them, there's not an ulcer in sight. And you're like, well, it probably wasn't the GastroGuard.
So why would the pyloric area be more sensitive to forming ulcers?
It's not more sensitive, it's more difficult to treat. I don't know why it's more difficult to treat.
But Because I think it actually said that
You're-
that
you're-
area is a little more prone to it, or?
No, you're equally, you're 50-50 on, you're equally as likely to get ulcers in the pyloric area as you are to get them in the margo plicatus. And the thing is, on that, the interesting thing is they're just not related. So you can't go in and see. Hang on a second. Okay, so now you see the difference between this tissue and the pyloric area, how much smoother that opening of the small intestine. Again, if you look at the diagram back there, you can see that the pylorus goes into the small intestine, and this is back to that squamous region. This region down here, the glandular area, that's where both the bicarbonate and the mucus and the acid-producing cells are down there. So the area up top, there. So this area that we're looking at, this squamous area, is more likely to be damaged. Now the other thing, that's probably good, is that when horses work or run, that's when they get the acid splashes up top. Now these cells, this squamous portion of the GI tract, the non-glandular portion, there's a couple of ways that it protects itself against ulcers. And one of the ways it protects itself against getting ulcerated is the cells turn over frequently. So cancer, when you have cancer as a human patient and they put you on an antineoplastic drug, what the cancer drugs do is they kill rapidly dividing cells because cancer is a rapidly dividing cell. Well, so that's when the things that happen is you lose your hair because your hair turns over rapidly, or it's supposed to until you get to my age. And then your stomach lining turns over rapidly. So the side effects to chemotherapeutic agents are you get baldness and really bad GI injury. One of the chemicals that helps this turn over rapidly are things called prostaglandins. And drugs, and there are two types. There's a good prostaglandin that's just there all the time. It's the house cleaning prostaglandin. And then there's the kind of prostaglandin that you get when you whap your shin on something and you get, the first pain is neurological pain, but when it gets the next day and it's sore, or you get a vaccine, there's some things in there. Prostaglandins are also, they're not housekeeping, they're the neighbors that come in from next door and wreak havoc. So, kind of like a goat. Right, so the inflammatory ones are prostaglandins. Now, the old style non-steroidal anti-inflammatories, the old style drugs, which are basically bute and banamine, aspirin for people, but let's just go with bute. They block the nosy neighbor and they block the housekeeper. So if you put an animal on bute for a long period of time, the reason they get ulcers is not because the bute's acidic and it's rotting the stomach, it's because it blocked the prostaglandin that allows that to turn over, to have new, young, strong, healthy cells. So what happens is they get really old. And as they get old, they get weaker, and they're less likely to ward off the acid that's produced, which is why bute is related to ulcerations, because it doesn't allow the system to turn over very well.
Like on the screen, is that the same, the lower part of the stomach, the red?
Yeah.
That was on the left? Okay.
Yeah, it just depends on how I twist this. I guess there.
There it is.
Yeah, there we go.
That's
And
the gland. That's all the glandular portion of the stomach, with the fluid down at the bottom. We're actually, this is one of the very few times where the scope's actually right side up. But you can see how different that tissue looks. That looks more like the small intestine, except it's a deeper red.
And does that tissue turn over a lot as well?
Not as much.
So now the muscles that would control this.
There's smooth muscle.
The smooth muscle.
So is that just all goop and food?
Yeah, this is like 24 hours out from
Put some hay sitting there.
right, and that's still food down in there. you know. Yeah, it's 6 hours. Forget. I mean, that's what I'm saying. If they get outside or somebody feeds them, and I go, all I do is I get this is that. When we were lost in the bubbles, just make that a lot greener, and that's all you see because they're so filled up with food. But it's almost like a Grand Canyon kind of
Yeah.
going down in there, and that's just normal
Is
motility.
that,
Is that anything right there?
that
That, like,
white
yeah, that white thing?
So that's gonna be
Food.
snot.
Lots of mucus, right?
Let's see.
Okay. So this stuff also produces mucus.
Yeah.
As
Which
well
is
as the gas.
right, and the mucus layer helps
Protects.
protect. Yeah. See, this is
Like,
also.
no, that-
Sometimes you'll see like little round red spots like there. That one that goes by would be kind of fun. Wait, let's see if we can. I lost it. Sorry. I was gonna see if we could wash it off. But that's the kind of thing you see if you've got bots that are attached at one point. They'll leave these little tiny brown ulcerated areas, and you rarely see them these days. Every once in a while, I get a horse that gets loaded. Maybe 2 in 20 years.
So there aren't that many here? 'Cause
You know what? You can get them off with a buckcomb. People go, well, you can't use blasphemy. You can't find bots or tapeworms on fecals. Well, that's true. The bots. It's not true. The tapes. About 25% of the time you find the tapes. But quite honestly, they're
tapeworms
not
are
a
pretty cool.
yeah, they're not a big deal for the most part. They can be, but they're so unusual.
I consider my director gold off the long ago.
That's probably right in the center there. Just lost it.
A bot?
It's like a video, no,
no,
guys
it's like where one might have been attached.
Oh.
See that sort of reddish one to the left of center?
It's like a little
It's
mosquito.
gonna be over here. Right there. That one?
Mm-hmm.
That doesn't look like food. Yeah, it's right in the center, almost right where the pointer is. Yes.
Yeah.
Right there. Right where the pointer is, right dead center.
Just on there.
See how it looks like it's raised up on the edges a little bit and kind of right in the center? Yeah, and a bot would actually look like sort of a pale football attached to it, and they're all over the place when you see them. This is,
Well, I was just wondering if there aren't as many bots up here in New England as there are.
I don't know that, you can get arguments about tapeworms being more prevalent in the South too, but I think, again, in 20 some odd years, I've seen two horses that had tapeworm, truly tapeworm issues that probably caused, one was in surgery that probably caused the colic, and one was